So what happens after you go home? There's a lot of information that you've had today, but when you go in for transplant in hospital, there is a huge amount of information, and it's really a new life that you're starting, hopefully, when you get home. So you'll be pleased to know that no transplant unit in the country just leaves you by yourself, and there's a huge amount of support available when you go home from everyone and every part of the members of the team that you've heard from today. So I'll go through quickly what we do. Now, you'll obviously be seen in clinic, and that's gone. And when you're seen in clinic, there's a number of different people available. So there's the clinic nurses, there's the transplant surgeons, the kidney doctors, the pharmacy team, nursing assistants, phlebotomy staff, and the clerical staff. And a lot of them you'll have seen while on the ward, but a lot will be new to you, and they'll be sort of the new team that take over your care. Initially in Manchester, we see our patients twice a week for the first month, and then after that, we spread it out to once a month, and then we try and space out the clinic appointments so that it's longer and longer between visits. And that's really, initially, we obviously want to be very careful that your creatinine and your kidney function is very good, that you're able to eat and drink, that there's no post-surgical infections, that your drug levels are monitored very carefully. So initially the care is more intensive, but hopefully very quickly that spreads out with time. And all these different members of the team will work as part of a group to ensure that, that everything is going well. So as I've said, they're fairly regular, they're intensive follow-up. Prior to COVID, it always used to be face-to-face. But if you want to look for some, there are some positives of COVID that we've learned from, and of course this webinar is one of them. But we've taken clinic as well virtually, so we are seeing more and more patients virtually. Now, that doesn't mean you can have your bloods done online. Of course, you need to go somewhere to have your blood tests done, and we can't avoid those appointments. But what it does mean is you may come in for your blood tests and then go straight back home again. So you're only in sort of for 5-10 minutes before going back home. And then we'll wait for your blood test to come back, and within a day or two, we'll then call you, make sure that you're well, check your symptoms, check your drugs, and go through your blood tests and your blood pressure and things with you online. So although you still have to come in, you're in contact with far less people, and you're in for a much shorter time. And then again, over time, if you can get your blood test done at your GP or your local hospitals, your results can then be sent in. So we're trying to make it much more streamlined and much more convenient, so your patients are not traveling long distances to their central transplant unit, which has been a huge benefit of COVID. As I've said, the frequency of visits decreases with time, and the minimum time that we need to see you is every 3 to 4 months. And that's really to make sure that your drug levels are okay, and we wanted to be doing blood tests to check your kidneys working every 3 or 4 months. And in the best case, it normally takes about a year to get to a 3 or 4 monthly visit. Transplant units are very centralized, as you've seen. There's only about 20 in the UK, but there are a number of different kidney units that feed into each transplant center. And each transplant center will probably have 3 or 4 different kidney units that refer in for transplant. And when I say repatriation back to your referring center, it's essentially a case of sending you back to your own kidney unit that's closest to your home, that you've probably had a lot of the pre-transplant workup and care. And that's practical reasons, because as a transplant center, we can't keep every transplant patient we've ever transplanted just for logistical reasons. But also, obviously, it makes it easier for you as a patient to be much closer to home and to have your follow-up there. So once there are no surgical issues, then we tend to refer our patients back to your local transplant, to your local kidney units. And in Manchester, we do that after about 3 or 4 months. COVID has forced us to do that slightly sooner, but it's really depending on the kidney unit that is your home unit as to how quickly they are happy to accept you. And in some cases, it may just be after a few weeks. In other cases, it may be after a few months. That's partly depends on how smooth your post-transplant journey has been as well. But you should be looking to getting back to your local unit for ease and convenience. So what happens in clinic, and a number of this has been discussed already, but we do your weight and blood pressure monitoring. We check your blood tests, we check your urine just to make sure there's no infections. Wound care is obviously a huge part of the workload soon after a transplant to make sure there's no problems with your wound. You'll get a medical review from either the medical or the surgical team. And as Sean has spoken to you, you'll get a full pharmacy review as well. So if there's any ongoing questions or any ongoing problems with your medicines, then pharmacists will be available to support you. There's then ongoing support and advice from the nursing team, and that goes more than just the medical support, but support with travel, with health insurance, with skincare. All these things, the nursing staff are hugely valuable in giving long-term advice with regards to this, as well as a number of charities that really help. And as I said, virtual blood tests may be available. So if you can get your blood test done at your GP center, and then we can see you virtually. And if there's a problem, then we can invite you to come in, but it does avoid you having to come in. And patients are finding it much more useful because you can essentially be at work, you can be at home. We call you, we'll give you a time slot of maybe an hour or two that we can call you, and the appointment takes 5-10 minutes. So it's just like having a coffee break at work and really doesn't disrupt anything. And it's far less intrusive. So the long-term follow-up, and I come back to what I said in one of my first talks, is it's really important to maintain a healthy lifestyle. It's great to hear patients say that they can now eat and drink what they want after a transplant, and that's a real benefit of transplant. But we would really stress that maintaining that healthy lifestyle will not only make you feel better, but is likely to keep the kidney lasting for longer as well. If you can keep on top of things like diabetes, blood pressure, fluid intake, then it does help the kidney last for longer. Taking medication as directed, as Sean has said, will go a long way in giving your kidney as much life as possible, and attending appointments as and when required. You'll have advice on going back to work, and a number of people, especially if you're young and work prior transplant, are very keen to get back to work because it's an element of normality that we can give you with transplant. So we'll advise on going back to work and provide practical advice depending on what kind of work you do as to how quickly and how realistic it is to go back to work. In addition to holidays and skincare and family planning as well, because family planning after transplant needs to be carefully considered because of the drugs that you're on. Okay, so that's it. I did say I'd be quick, and hopefully we've got time for questions either straight away or at the end.
Thank you, Hussein. We did have an earlier question about CMV infection after transplant.
All right.
How many times can it come back after being treated? Okay.
How long is a piece of string, I'm afraid? So CMV, for those that don't know, is what we call an opportunistic infection. So this is an infection that doesn't normally cause any problems in people who are otherwise fit and well and have normal immune systems. But if you're on drugs that lower the effectiveness of your immune system, such as immunosuppressants, then CMV is a virus that can cause problems. And it can cause problems almost in any system of the body. It can affect kidney function, it can affect your lungs, it can affect your bowel, it can give you sort of cold, mild cold-like symptoms as well. And patients, and about 80% of the normal population carry CMV with them. And it's just something that we normally, you do pick up. And you probably don't even know you've got it unless it's been checked for. Now, all recipients and donors are checked to see if they carry CMV. And if a recipient carries CMV, then depending on the anti-rejection tablets we use, we may or may not give CMV prophylaxis, which essentially tries to prevent CMV infection after transplant. If a donor carries CMV, then again, the recipient may or may not need CMV prophylaxis to try and prevent CMV infection. And depending on which unit you're in, that will either be given for 3 or 6 months, but at some point it has to stop. And when it stops, we would then monitor CMV levels in clinic. And if we see the CMV levels rise, so you have a CMV infection, we would then start treatment for you. Okay. But if you're prone to it, there's nothing that we can do to get rid of it completely. And you're always at risk of CMV infection coming back, which is why every transplant center, when you have follow-up, if they know you're prone to CMV, will continue to monitor it as an outpatient.
And we have someone here who's wondering how quickly can you travel abroad post-transplant? Now, at the moment, for many, that's a wishful thought that we can travel abroad under normal circumstances. What would the guidelines and suggestions be?
So under normal circumstances, We'd normally say about 6 months to go to Western Europe, okay, only because you're closer to the UK, the medical services are slightly more reliable, and then a year to go further afield and go long haul is the general advice, assuming that everything is fairly straightforward around the time of transplant.
And a key factor when we're talking of those holidays, we'll anticipate the sunshine there. Can you explain the protocol? Skincare has been mentioned, but we never went into any detail over skincare post-transplant.
Sure. So skincare is really, really important. I think a number of the talks have said that the anti-rejection tablets make you more prone to things like skin cancers. Okay. Now, thankfully, most of the skin cancers can be fairly minor, but they do need treating and surgery and things. The most important thing is factor 50 sunblock, wearing hats, trying to stay covered, staying out of direct sunlight is incredibly important in looking after your skin following transplant when you're on these anti-rejection tablets. Okay, it doesn't mean you can't go abroad and enjoy the sun, just need to be sensible with it, and wearing factor 50 is the best thing you can do.
Thank you. So I am right to be a narky wife and go on holiday and remind my husband, who's slightly balding on the top, hat, suntan lotion, and in the shades.
Yeah, absolutely.
We had we had another question about CMV, and actually something I was interested in as well, about the monitoring, because it doesn't appear to show on patient view. I think it's on patient view we don't get all the blood tests that are seen by the MDT.
Okay. I didn't know that, actually. I thought you could see everything. I don't know. I wouldn't be able to tell you why that is, but I could find out. Is it something that you would like to see?
Well, I like to see everything, but maybe unusual.
I can find out. I didn't know. I assumed you'd see everything.
Well, it may be. Well, of course, they don't always. The names are not always the same, are they? I mean, it depends how it's described, I guess. Thank you. Susan, can you see anything else relating to the clinic? I think most of the other questions are more general or related to the transplant process.
But just out of interest, there's a donor question here for living donors.
Okay.
How long would they expect their recuperation to be? And an average time for the workup process for a donor? Okay.
So we would say the workup process is probably on average between 3 and 6 months, if everything goes well. And recuperation is up to 6 to 8 weeks. Now, that doesn't mean, we expect donors to be up and out of bed the following day. And donors tend to go home on day 3 or 4 following surgery. So you should be up and about and mobile. But it is still a fairly big operation. And to be back to reasonably normal life, we'd say 6 to 8 weeks.